seeing the fixes. The results are starting to show themselves. This package is needed.
Minnesota Governor Tim Walz announcing his administration is introducing a package of bills aimed at fighting fraud within state programs. Good evening, I'm Laura Lee.
And I'm Dan Wolf. Thanks for joining us. Walz's announcement comes months after allegations of billions of dollars worth of fraud in Minnesota.
As we reported just yesterday, Vice President J.D. Vance announced a pause in federal Medicaid funding to Minnesota as these fraud investigations play out.
Now, Walz said the bills would help prevent, detect, investigate, and hold accountable anyone who commits fraud. Specifically, his proposals include using predictive analysis and establishing a centralized Office of Inspector General. It would also increase penalties by 20% and expand the window in which these crimes can be prosecuted. Now, Walz says the pause in Medicaid funding from the Trump administration could impact 400,000 Minnesotans who need health care.
Northern News Now, Sophia Lauber heard from lawmakers and Northland organizations responding to that funding freeze. Sophia, what could it mean for them?
Laura and Dan, it could be a real hit to both providers who receive Medicaid funds and patients that depend on the program for health care. A local organization supporting older adults in the Northland tells me it would hit rural hospitals the hardest as they depend on Medicaid reimbursements to fund crucial services.
A lot of our rural organizations operate already on very thin margins, and so any kind of funding disruption will really create financial chaos for them.
Director of the Arrowhead Agency on Aging, Rebecca Sash, says a Medicaid funding pause could impact everything from staffing levels and care at hospitals to everyday activities for elderly patients.
That waiver helps them stay in their home by providing transportation, homemaking services, meals to the older adult.
Governor Tim Walz called the Medicaid pause illegal and unprecedented.
We saw an incredibly damaging continuation of the reckoning and retribution campaign by the Trump administration.
On the other side, Northland Republican State Rep Natalie Zalesnikar believes it's not an unreasonable move by the federal government.
They actually have an obligation to make sure that the people's money is really going to serve the people. So you have to show attendance.
While she's concerned about patient impact, she says it's the path the state has chosen by allowing fraud.
But it's a choice by the state of Minnesota. I mean, we've been out of compliance for now quite a few years.
According to Minnesota DHS officials, the administration will withhold up to $260 million quarterly until fraud review is complete. That's a process they worry could be lengthy and disastrous for Medicaid and those that depend on it.
In Minnesota, Medicaid is paying for jobs at hospitals, it's paying for a caregiver to go to work in the morning so that the person they're taking care of has a caregiver during the day, for example. So even if someone isn't on Medicaid, they're still being impacted by it through the community that they live in.
In addition to Rep. Zalesnikar, I reached out to a number of local lawmakers today. In a statement, DFLer Rep. Pete Johnson of Duluth echoed Walz in calling the pause an act of retribution, which he says puts children and the elderly at risk. Live in studio, Sophia Lauber, Northern News Now.
Thank you, Sophia. In January, we heard from personal care assistants working without pay while Medicaid reimbursements are being withheld. You can find that full story by downloading our Northern News Now app.